recording. But I'm happy to see some folks here that weren't sure they were going to make it. So, yeah, but we're going to talk about important stuff that will be relevant for you all, both on field work, but also actually on NBCOT. They're going to cover this stuff for you all. So this is kind of a good start getting this digesting in your brain. Okay. Before that, there's a little, and then I'm happy to say, I mean, I really feel like we're in a really good place with onboarding you all. We're kind of coming into that time frame of that like 10-week, 8 weeks out. A lot of sites are saying they're going to send stuff at 6 weeks. I know it's just a fun game because we're all on different schedules and have different things going on, but you all have been like so responsive, and I'm feeling like we're on top of this. We got this onboarding thing, no problem. So if you haven't gotten instructions from your site yet, that just means that they don't need it yet. So I am kind of continuing to check in with them, and I think we should be good. So but this is something that comes up with some of our sites, so I just wanted to go over really quickly because in the past they have found that there's like a little cost with it if you have to go do this on your own. So here's Jason. Okay. So N95 fitting. So some of your sites might require that you have an N95 fitting. A lot of the hospitals will, should, can offer this as kind of their whole onboarding process that they'll have you go through. But some sites historically, I guess, have asked that you go do this. And so this is information that's been relayed to me. So you basically need to get a form confirming you're authorized to wear an N95. And so it is recommended you can do this through our student health center, and it's a little bit less expensive. So it's usually around $25. It can be more like 40 or so. And, you know, with the way things are going, maybe even more if you go somewhere else. So basically it's just, they're just seeing, they want a tight seal for the mask. They need to know what size mask that you need, and just to ensure that they have those available for you. I have not gotten any notification yet about any of you all having to go do this N95 fitting on your own. But just to kind of put that in your head so you're not kind of like, what the heck is that? And this is just info that's been passed along to me from past. Okay. But so going along here to really fun stuff. So AOTA Code of Ethics. A lot of this, I'm sure for you, is going to feel kind of intuitive, assumed almost, but it is stuff that's been, you know, written out, written down, and things that you are expected to adhere to as you move into becoming an OT practitioner. And then again, you're going to be tested on as well. But of course, as you go out into field work and you're starting to, you know, step into this role as a practitioner, these are things that you're expected to also be adhering to and showing that you understand. So that's why we also put that here for us to go through as you prepare for field work. This is annoying me. I can't remove that. It's always something new. But okay, so for Code of Ethics, there's kind of these 3 different chunks. They're basically these professional guidelines, right? And they're supposed to just help you make proper choices as a healthcare practitioner. So the first one are the core values. So core values is basically this foundation that are supposed to guide your interactions and just kind of how you show up as an OT. And so these are all the different areas that they have identified under the core values section. So altruism. Altruism is essentially your ability to place the needs of others before your own. And that kind of like folds over into safety stuff, right? So that's kind of what they're thinking. I mean, of course, we all want you all to stay safe and be taking care of yourselves, but that's what that means. Equality, a desire to promote fairness in your interactions with others. And this is with clients, other folks, you know, professionals you're working with, etc. Freedom. So freedom and personal choice is in there as a core value, and I think is really important in how we approach OT, right? Freedom for your clients to really engage and show up and, design goals with you in a way that is meaningful to them. So that really should guide your interventions and guide how you work with folks. Justice. So if you're a practitioner, educator, researcher of any type, we're to relate in a fair and impartial manner to individuals and show respect and adhere to, of course, laws and standards, etc. So that is all encompassed under this idea of justice. That's a core value. Dignity. So again, I think this really is another one of those things that kind of embodies OT, is to promote and preserve the individuality of the client, right? It's that real like client-centered care, the aspect of OT that I know I love. So dignity kind of comes through in that too, right? And assisting them to engage in occupations that are meaningful, and and just engage in their lives. And through that kind of brings this dignity value, right? Okay, another core value, truth. So you must provide accurate information. I've touched on this before, just, in introducing yourself as a student, for instance. If you don't fully, know the answer to a question, I mean, that's where truth is really important. And that's actually going to like create a lot of confidence in your relationship. If you are just truthful, honest, that's always just going to be the best approach. And same when you work with your educator, of course, too. Okay. And then lastly, for a core value, we have prudence. So this is kind of a unique word. It's not used maybe as much. But with that, you're kind of thinking about using your clinical and ethical reasoning skills. This is where you're just, trying to make good decisions about how to engage in your practice, design your care plan, all of it. That's where that kind of like critical reasoning piece comes through. But you're just always grounded in this idea of ethical reasoning is a big piece of that. Okay, so yay, core values. Okay, so there's gonna be a little bit of talking, just putting this stuff out at you guys, and then we'll do some like discussion and engagement with these terms. Okay, so next are the principles. These are all the principles. I'll go through them here. So principles, beneficence. Occupational therapy personnel should demonstrate a concern for the well-being and safety of persons. Non-maleficence. Occupational therapy personnel shall refrain from actions that cause harm. Autonomy. I think this is really important, especially, I mean, you may be at sites where you're not going to do a lot of like in-depth training about HIPAA. Some of our sites don't have to adhere to HIPAA, for instance, and such, but it's really important to maintain this understanding of self-determination, privacy, confidentiality, consent. I mean, that is just a overall principle as an occupational therapist, even if you are not bound by these higher up, entities that can exist in these bigger systems. That is always just a really important principle for all of us as OT practitioners. So justice, occupational therapy personnel should promote equity, inclusion, objectivity in the provision of services. Veracity. So that's providing comprehensive, accurate, objective information when representing the profession. And again, I'm just going to go back to that point with you guys. I mean, really, I encourage you to just be straightforward about like stuff you're confident about, stuff that you want to go and look up and bring back to the client. just saying that, right? And so your veracity, you want to be comprehensive when you feel like you can, but you want to be accurate and objective and also grounded in, evidence, etc. Even if it means you need to come back or pull in your fieldwork educator if you know it's someone that's discharging that day, just staying really grounded in that and being confident in that. That is always a better route to go. Fidelity. Occupational therapy personnel shall treat clients, persons, groups, populations, etc., colleagues, everyone with respect, fairness, discretion, integrity. Okay. So an MBCOT test question. So this is an example of what you might see on your MBCOT test that could be related to all of these terms where you're going to need to know this and be able to think about this. So you're a therapist. You notice that two other therapists are talking to each other and you overhear them talking about a patient in front of another patient. So what OT code of ethics is being broken? Anyone just jump in and go ahead and say. Yeah, so Megan said confidentiality. Yeah. And I want to say, as a practitioner at the Children's Hospital, I have seen this. This will happen, and you will see that it's almost like in the culture of certain places, even though you're really not supposed to do it. Especially some of you that might be going to some of those bigger hospital systems that are receiving folks, you might receive someone that's been in the news. They may be on your caseload or they may be on an adjacent caseload. You really need to be careful about, discussion, talking about any of that because you're really not supposed to. And that can literally lead to the termination of your field work. Like no questions asked, nothing done. Because the hospital has to also be, showing the community that they're upholding a certain level. And this has come up, and I'm going to speak to this again later because it really hurt my heart when this happened for a student. But this has come up, and it was like a little thing, and you could kind of understand how it was an easy mistake that happened. But at the same time, I understood that the hospital had to say, "I'm sorry, but we're going to have to terminate this field work." So really, really, really pay attention to these things. It's important, and it's important because that's you are now a practitioner. You're looking out for the best interest of these folks that you're working with. So that's my big message on that. And I will say that again in a little bit different context. Okay. So, yay, I'm sure you all don't have like all of that perfectly memorized in your head, but I thought we'd do just kind of like a little activity, just another way to kind of engage with these words and start kind of digesting them into your brain. You can certainly cram them before the MBCOT exam as well, but just to give you a chance to kind of be, again, digesting this stuff. So we are building those neuronal connections. So what we're going to do is do a little crossword puzzle. So I'm going to break you into small groups like we did before. Just going to I'm going to assign them for you. And I have no clue how long this is going to take. It may go quick, but all of you just work within the group. I'm going to be moving between the groups to see kind of where people are at. And when I feel like we're mostly finished up, I'll just pull you all back to the group. So I need to keep sharing this while I break out. Just a sec. Okay. Okay, so sorry, just a sec. Okay, so I'm going to put you into your rooms and you can start working through this together. If someone has like a piece of paper, maybe you can like write down the answers.
think we finished before everyone else. We have bragging rights.
Yes.
Yeah. Oops.
All right. Okay, good work, y'all. Looks like almost everyone's back. So there was a nice takeaway in one of the groups we were talking about kind of a good way to essentially like study and digest these terms is to go through them and read the definition and then maybe like reword it in how you would describe that in your own words. And I think, in fact, that's most likely, I think, how I studied this stuff is because, yeah. So I highly recommend that. I think that was a good piece of advice to do when you're trying to digest all these different terms and understand kind of the little differences. Give it your own words that you use. Okay. So moving on. Principle. Wait, where are we? Nope. Okay. Well, I guess I can give you guys, does anyone, do you want to check your answers? Okay, I'll read them out. Just, yeah, sorry. Okay, and by the way, oops, there's one that was repeated. So bonus points for anyone that was like so confident about that there was a repeat, because there was. Okay, so.
Can we ask a follow-up question to that?
Absolutely.
Is it because it's both a principle and part of the code of ethics?
Well, not necessarily. These weren't constructed necessarily to be divided like across and down. I know some folks were thinking that they were supposed to be mixed up. But in terms of why, so honestly, obviously I did not create this. So maybe that's why they did it twice. I don't know. Good question, but maybe. Okay, well, anyways, getting to the answers. 1 down was justice. 3 down was fidelity. 5 down was equality. And 6 down is beneficence. 8 down is autonomy. And 9 down is dignity. Did anyone get all those? All the downs? And then, okay, so across, 2 across was truth. 3 across is freedom. 4 across was justice. 7 across was veracity. 10 across was altruism. 11 across was non-maleficence. And 12 across was prudence. So did anyone get all of them right? There's a lot, if you look online, there's a lot of kind of activities and stuff like this too, if you want to kind of be studying. But as we think about going into level 2s, just keeping all this in mind, and we'll touch, there's kind of some overlap too as we move into the professionalism part of our discussion today. Okay. Hold on, where am I? Sorry. Okay, but first, standards of conduct. Standards of conduct. So AJOT also has these standards of conduct. Honestly, there's a lot of redundancy, I think, but you know, I'm just to present all of this to you. So
Hey,
a standard of,
Katie,
yes.
could you share your screen again?
Yep, just
Thank you.
realized.
Sorry to interrupt.
Okay, yep, we'll do that. Okay. Okay. So, standard of conduct, professional integrity, responsibility, and accountability. So you're to maintain awareness and comply with AOTA principles and official documents and current laws and regulations. That's a standard of conduct. You basically just have to keep up with both your, you know, regional laws, but also specific to OT. Therapeutic relationships. OT personnel to develop therapeutic relationships to promote occupational well-being in all persons, groups, organizations, and society, regardless of all of these factors. That, of course, I'm guessing should be an ongoing thread that you've had in your didactic work, and you want to carry that into you can see just every way in which you engage with folks, keeping that therapeutic relationship. Documentation, reimbursement, and financials. You must maintain complete, accurate, and timely records of all client encounters. But a caveat to this is that really can vary depending on where your site is. I used to work at a site where our documentation was very minimal, but it was accurate and it was timely. And so that's where you're just going to have to kind of flex to the culture that you're in. But it is a standard of conduct that we are at least always documenting to some degree. Okay, service delivery standard of conduct. Personnel will strive to deliver quality services that are occupation-based, client-centered, safe, interactive, culturally sensitive, evidence-based, and consistent with therapy's values and philosophies. So I really like this. I like that all of these pieces are like specified within our service delivery kind of code, essentially. And just a good reminder that is a ubiquitous expectation for OTs in general. Communication. So whether in written, verbal, electronic, all forms of communication, you're up to uphold the highest standards of confidentiality, informed consent, autonomy, accuracy, timeliness, and record management. So again, there can be a lot of flex within, you know, your specific site's requirements, but just knowing that as an OT practitioner in general, if you open your own clinic, there are standards of conduct that you really need to, at some degree, to some degree, being holding yourself to, right? So there does need to be at least some sort of these elements in your communications. professional civility. All occupational therapy personnel should conduct themselves in a civil manner during all discourse. And so they specify that civility entails honoring one's personal values while simultaneously listening to disparate points of view. These values include cultural sensitivity and humility. So I think this is interesting. Of course, we all have our own values, but we also need to be able to engage and allow a person, of course, to kind of show up how they're going to show up as long as it's safe and not causing harm. Okay. So now I want you to kind of think about the worst case scenarios if you're out on field work. So these are all the things that we should be perfectly adhering to at all times. And you all, I think, have had really good ideas in our past seminars about kind of how to approach situations. So I wanted to kind of just leave it free form. Anyone that wants to type into chat or just unmute and speak out thoughts, but what do you do thinking about these standards of conduct, thinking about, all of these codes and things that we've reviewed? What do you do if you're out and you feel like your fieldwork educator is not following many of these codes of conduct or ethics, etc.? What would be maybe the first thing that you should do? You're worried that, say, your fieldwork educator is not, let's just pick one, give you a more concrete thing. Okay, so you feel that your fieldwork educator is not showing good client-centered, culturally sensitive practices. Oh, let me pull up my chat again. Okay, sorry, there's a couple chats I've missed here. Megan, yes, back to my point that I wanted to make very clearly about the HIPAA stuff. And this is what I was going to speak to in a minute, is about, yeah, how the electronic records trackers are keeping track of everything you do. But we'll talk about that again in a minute. Okay, so to this question, email advisor and me. Yes, either or. If you feel more comfortable first reaching out to your advisor, you can do that. Definitely reach out to me, email me. What I will probably do is I'll gather information, and then I will probably suggest that we all, have a meeting all together and just kind of to present. And like we talked about in a prior seminar, go into it assuming best intent, asking questions, gathering more information. That's kind of the vibe that I would approach it with. But certainly you can expect that I will be there to be your advocate. But yeah, that's the best. And certainly there's some things like safety and things like that where expediency might be more important over other things. So that's where you can kind of, weigh it. Like we talked about, maybe giving it another chance. Like maybe if it's something about cultural sensitivity, maybe it's something where you're like, that just didn't sit right with me. And if you see another instance of that, be like, okay, this is starting to feel uncomfortable, and reach out. You know what I mean? But if there's something like safety, things that are feeling more immediate to you, and this is where, it's almost that clinical reasoning piece, maybe reaching out to me right away. Yeah, go ahead, Lyric.
Can you maybe just briefly talk a little bit about what is in place if we do need to leave a fieldwork site midway through? Is there like Pacific has like a backup, like, oh, this place is always kind of open, or like what does that look like?
Yeah, I mean, essentially, I will work with you all. And from what I've understood, I mean, and what I would do is we would just account for the weeks that you've put in, and we would just arrange for, additional weeks so that you meet your sufficient, for ACO, we have to get you the 12 weeks. And so we would almost kind of like put together a two-piece rotation. You wouldn't essentially start over. So it happens so infrequently though, you all, like, really, this is kind of worst case scenario, but yeah, we definitely have lots of different creative approaches that we've taken. Sometimes it's been more, honestly, just more like medical leave situations and things like that, but there is always going to be a situation in which I will work with you to, yeah, keep you moving along in your program. So it's a good question. There's not really one easy answer to it, apart from just we get to start being really creative and that flexibility comes out. But it's important that we know that you all feel safe, that you all feel like you're in a good setting, et cetera, et cetera. So yeah. So it might not be,
Look at that.
oh, so yeah, so it'll just be, I am just here to work with you and we'll figure out a plan. Is kind of the best answer I can give you on that, I would say. But that kind of leads me into my next point. So the next thing I just wanted to say, it's also not your obligation to reform your fieldwork site. And you're really just not going to be in the position to do that, right? And so it's also a discussion that we will need to have as to, like, is this still an appropriate site for you? What all is happening there, and what we can make that decision together for sure. Because yeah. But the next piece I wanted to speak to you guys about and just let you know, so there are a good number of different resources here at Pacific. If there is more specific concerns or supports that you would benefit from, even if, say, we're having you leave a site, there can still be stuff to process. There can still be things, to work through. There can still be supports needed, even if I, on the logistical side of things, and am helping you to continue with your training, right? So I wanted to let you know, and I've linked this on the Moodle page as well, and I'm just going to kind of scroll through here to show you. So there is an array of different types of supports that are here at Pacific that I didn't know if you all are familiar with. And so I've linked this site, and they've put them all together in this one site. I'm just going to kind of scroll down. And so there are resources where you can go in, click in, literally put in a form reporting a need for support in a different area. So I'm just going to kind of scroll through. You can see this is something we're going to speak more specifically to. This is going to be the whole topic of our next seminar, because there is a very specific form for reporting bias, etc. And I've been told that the team here at Pacific is very quick to respond and excellent in working in these types of cases when they, unfortunately, if they have come up. So we'll speak to that. But you can see there's just kind of a whole different array of resources that are here for you, with like clickable links, immediate phone numbers to call, etc. So, and again, I can work with you too. I can be advocating and talking to folks as much as you want to, etc. But just to know there is kind of whole teams in all of these different categories here to help you. In addition to the folks here in the School of OT. So that is that. So any questions around that? It's a really big topic, and the answers tend to be just kind of like, we take it as it comes, and use all the resources, use any and really all the resources that we have here. Okay. But I will say, I've only been doing this about a year with Pacific, but thankfully, these are few and far between. And in terms of especially like code of ethics, things like that, it's thankfully really not showing up for us a lot, but I am always here to support you. Okay, another thing that can happen is you can have an injury while you're out on field work, or you maybe have an exposure, like a TB exposure. Things like that. Pacific does not have an umbrella protocol. They actually just default to wherever you're at, whatever the site procedure is for that. And so when you are getting oriented and starting up at your sites, they will most likely cover these types of things. And if not, definitely ask questions. And then as far as injury, definitely reach out to me and let me know if you're injured, because there will be logistical things for us to think about. I need to keep track of that, and Pacific tracks that. And so I will also be tracking that with our systems. But in terms of your care, we will need to start with using your personal health insurance to help you through that injury. And then the university gap insurance kicks in. But we do have to start with that personal health insurance that you have. And I just have been told that we are not able to use Pacific workers' comp in these instances. So that would be kind of the process for getting support and medical assistance as needed. So any questions with that? So we're right about, I usually about an hour in here, and we're right on time. I like to give you guys a little break. So we're at break. Let's take just 5 minutes. That's okay. So come back at 3:35 and we'll keep going. Okay, we're gonna get going right away. We still have a good amount of stuff to go through. Okay. Okay, so ethics in field work. This is just kind of going to be some general stuff just to kind of flag in your brains and keep in the back of your head. Okay. So there are ethical responsibilities of your educator. So again, this is just for you to be knowing of and confident in, because of course, if there are breaches in this, I want you reaching out to me. So ethical responsibilities to keep your clients safe and ensure their well-being, provide accurate supervision. You want them to be giving you the just right challenge. So if that's too much or too little, again, reach out to me, because really that is on your educator to be tailoring your training to where you are at, right? And they're literally trained to do this, right? So they should be able to also do that with you. So if they're not reaching out to me. It's their responsibility to be balancing their work demands in terms of productivity, etc. They've made a commitment to you. So just know that is something that they've signed up for and is their responsibility to be juggling and managing. They are serving as a role model for you, of course, and giving you effective educational experiences. And then they also need to be maintaining that confidentiality and demonstrating that to you. So for you as a student, you want to also be looking, safety is always just like number one, right? Really important, and well-being. You want to understand and adhere to all these ethical codes and policies, etc. You want to be really clear about specific things with your site, and be ready to handle any situations that may come up. I really encourage you to be transparent when you communicate. You know, we've talked about with clients, talking about transparency with what you know, who you are, what your training is, where you are in your training, etc. Transparency with your educator, they are there to help you. And just being really honest about how competent you're feeling and how confident you are feeling. Okay. I said I was going to touch on this again. Megan mentioned it earlier. You really need to maintain confidentiality. And this is something, you all, that I literally had come up. And it will be an immediate termination of your field work. So it can be at a site that adheres to HIPAA. It could be at a site that just has their own standards, and they relay to me that unfortunately you have not upheld those, and they really have to let their community know that these are standards that they uphold. And it's really something where there's not a lot of wiggle room. And so just when you go through those HIPAA trainings, just, lock in and digest that information, because sometimes it can be counterintuitive. I mean, you are not allowed to look up, if you have a child in the system, you are not to be looking at their records, right? You have to go through the proper channels to request those records, even if essentially you can, as their, caregiver or parent or whatnot. You have to go through the correct channels. Same thing about, you hear about a crazy incident, case that just came in through the ER, they're in the news. Do not look up those folks in the records. They will see it, and it is so automatic. It is flagged to departments. I mean, you would be amazed how quickly it's flagged. And before you know it, you will be leaving your fieldwork. It will not be good. So please, please, please pay attention to that stuff. Okay. So standards of conduct, a lot of the same stuff, you guys, but documentation, reimbursement, financial matters. You are expected to be following all the same standards that your site follows. And I'm seeing a chat here. Let me grab it. Sorry, my chat box closed. Where'd it go? Come on. Chat box. Nope, no new chat. Okay, sorry. Okay, some of it's feeling redundant, so I'm just kind of moving along here. Service delivery. Okay. So yeah, so service delivery just basically means you need to be providing services for what you have been trained. And that's where you need to also follow that veracity and understand, you know, kind of your level of competence, right? And also be transparent with your educator. If you didn't learn something in school, that's not necessarily, you know, your fault. You need to let them know though. So that's kind of where that may come out. Professional competence, education, supervision, training. So representing credentials and qualifications. Again, that's kind of like in that intro, when you go in to meet your client, it's great to say, hi, my name is Katie. I am a, you know, occupational therapy student from Pacific, and I'm so excited to work with you today. Ensure that when you delegate or you know, speak to different professionals, pull different professionals into your care plan, that is in their scope. So that's also kind of a standard that you need to be making sure you're following. If you have rec therapists at your site, you need to be really clear about, you know, what their scope is and how you can involve them in the treatment planning. Okay. So I feel like a lot of this is kind of redundant, so I'm going to keep going. Okay, so I like this little activity. I have decided for time though, I think we're gonna just do it as a group. It feels like chat is a nice way for you all to kind of answer questions. So type in responses to these questions in the chat, or if you'd like to, just unmute. There's going to be a lot of right answers to this type of activity. And so I'd just love to hear kind of some ideas and thoughts on this. So we're not going to break up into groups. Okay, so here's a case example. Sam is doing well at their current level 2 rotation, receiving a glowing midterm eval from Alex, their fieldwork educator. Sam, however, does not share the same positive assessment. It seems their fieldwork educator, Alex, is rarely around when Sam has questions and frequently leaves early. So this is the educator, right? On a particularly busy afternoon, Alex, the student, is approached by Sam, the educator, asking them to pick up 3 additional clients that the educator could not treat that day. Alex, the educator, shared that they were headed out of town for the weekend and wanted to leave early to get ready for their plans. So on the way out the door, the educator said, "And can you please document treatment notes and the charts of the clients I saw this morning? I jotted down what I did with each one just to write them as if you did the treatments, sign your name, and I will co-sign on Monday when I return." So Sam, the student, is shocked by this request. Okay, so I kind of broke it down into bullets for easy reference as we think through this, but so first of all, which standards of conduct have been violated here? Any or all that you can think of? Supervision. Yeah. Anybody else? Veracity, it's a lie to say that he did treatments when he didn't. Definitely. Documentation. Yep. Yeah, it's just breaching a lot of different things. Professional integrity, responsibility, and accountability. Yeah. Yeah, exactly. So under the number 3, documentation, reimbursement, and financial matters, You're supposed to ensure that documentation for reimbursement purposes is done in accordance with applicable laws, guidelines, and regulations. This definitely goes against those regulations, as you all said. Professional competence, education, supervision, and training. So someone mentioned supervision. This is definitely not in accordance with AOTA official documents related to how you should be supervised, etc. I mean, there's just a number of different things to touch on here. Okay, so the fun one for number 2, what should Sam do next? What would you all do? Hopefully, I mean, most likely you're not going to be in the situation. If you were, what would you do?
I feel like this might be worth bringing up to like another trusted therapist wherever you are. If it's not an OT, then maybe a PT or just somebody else trusted, or even like office admin, maybe bringing it up to them.
Yeah, I mean, I really like that because it's that awkward situation, right? Of like, certainly you guys could, email me, but for this, if you all are in like a hospital setting where, a person is there, they're counting on having this information in the charts about like what the OT has done with them. This is information that needs to be, it can't be a huge time delay. So I really like, Kayla, your thought on that. We do need to try to loop in, appropriate folks at your site, especially, I would want you all to kind of think through kind of the immediacy of the situation, right? So if that is the case, absolutely. I think unfortunately it's going to be reaching out to that direct supervisor as if you were, an employee as well, as if you were another OT on that unit, who is the director, supervisor, etc., who they report to. You unfortunately might need to reach out to them and just flag that for them. And let them know that, you're also going to reach out to your school, but and you can say, just out of concern for, the best interest of these clients or this client, I just didn't want to let there be too much of a time delay between when this was addressed. And just know that I would certainly be there to back you up with that too. And so I'm just going to read out some of these responses too, because I like what you're saying. Okay. So advocate for yourself and say that you can't. So yeah, I mean, certainly, like, presumably, hopefully they're not like literally running out the door. Like, hopefully your educator is somewhat still talking to you, right? And so that's why I like kind of talking through this, to give you all kind of the confidence. If this, for some reason, I mean, if anything, maybe you're with an OT that's filling in for the day. I can see this happening, some type of thing happening, maybe with an OT that feels less kind of, responsibility to you. I can't imagine this happening, but yeah. And then Deanna, absolutely. I mean, I really urge you all to feel confident to say, and blame it on me. You could literally say, because we've had this seminar, right? Like, my fieldwork, coordinator has told me that, or this seems to go against kind of some of the things that my fieldwork coordinator told me that I could or should be doing on my own, etc. You can put it on me if that helps. But yeah, speaking up right in the moment is definitely going to be the best for the least amount of impact, hopefully. And then, yeah, so that's basically what a lot of you said following up here. Say no to the supervisor. So hopefully this gives you all more confidence in doing that. And you can even specify to Sam or whoever your educator, why you're saying no. I'm saying no for these reasons. So exactly, that's what someone said. I like this. This is a nice way to do it. Thank you for your trust and confidence in my abilities. However, I don't feel comfortable based on the core values of AOTA. Exactly. Or I don't feel comfortable based on, what I've been told I'm able to do in this position as a student, et cetera, et cetera. That's a very smart way to go about that. I like that. Okay. And yeah, and so appropriate actions to take next. So I would say you're all correct, like with that immediate response. And then there's kind of a next step after that, right? Because you have that encounter, you advocate for yourself in the moment with your educator, but then there are next steps. And so that is that next step of reaching out to me because there's a problem there, there's a disconnect, and we need to decide, okay, is this a situation where we need to be flexing and switching you to a different field work? Was this a misunderstanding? You know, that's where the bigger conversation can be had. So yeah, really good thoughts on all that. Okay. So lastly, we're just going to end on this professionalism. So this is really just a chance to kind of sum up and get us all on the same, the right mindset. I know you all have been like, you've been in student mode and going out into these clinicals, to these field works. You really are needing to kind of step into a very professional situation. You're showing up as a professional now in every aspect. And so you want to think about your appearance. You want to think about dress code. A lot of the sites have already relayed to you all some of their dress codes that they might have, and you really want to respect that. There's reasons, that these sites have these dress codes. You'll have more discretion and autonomy in deciding, where you work in the future and whether it kind of aligns with your own core values. But right now, while you're doing your training, it's really going to, it's going to help you and be in your best interest too, to really adhere to those. So we really need you doing that. You want to think about the way you speak to others. You're going to be engaging with folks like in all different generations, different ages. So using that real professional tone and way of speaking. We've talked a lot about confidentiality today and just general respect. So just a quick refresher. So a professional can be counted on. They demonstrate competence. They can receive feedback. We talked a lot about feedback already and how it, again, also benefits you, right? You have an awareness, aware of how you're showing up, aware of your own behavior, and you're able to keep your personal life separate and separate from work. So this is really, you're stepping into a very work setting, right? Okay, so professional behaviors, I don't know, can you think of professional behaviors that are more specific to, like, as an occupational therapist, how you can show that you're professional? I mean, maybe you're in scrubs, but what are ways in which you can kind of show up and really demonstrate that you're a professional? Be on time. Absolutely. Come prepared. Yeah, even coming into your sessions, having kind of a plan in your head really shows that you're holding it of high importance too. Research things you're unfamiliar about, be an active learner. Yeah, those two things kind of fall in that same bucket. So really taking ownership, right? And as you move through your 12 weeks, that's going to become, more and more increased. You're going to have more and more autonomy. It's going to be on you to kind of go home, and if there's something you need to refresh on and be ready for that next day, that you're doing that. Be ready to jump in and learn, even if it feels overwhelming. Absolutely. Yeah. Okay. So these are a couple of studies, just really wanting to drive home with you all. It's kind of similar to the feedback thing. These professional behaviors are really important. There's been, qualitative studies that really show that these verbal and nonverbal ways of communication, they can really matter. Work behaviors, time management, how you show up. It's going to, even if it doesn't overtly come out, it it impacts how you are received both by your clients and your educators and all the other professionals that you're going to be working with. So it's really important because it's also going to make you have a better experience. Another study just speaking to this and how it really ramps up your success if you show up in a very professional manner. So reasons to be professional. So this, again, redundant, but client perception, your supervisor, your educator's opinion, and then also something I really care about is you're representing OT, and it's a big deal. And every time you walk into a room, you introduce yourself, you say, you know, I'm Katie from Pacific University, I am an OTD student. You are now ongoing, always representing our profession. And that means a lot because I love this field. So another thing I want to just say to this professional behaviors, life happens, things happen. You may have a crazy thing where you get in a car accident on the way to work or, you know, barring, hopefully not, but things happen, right? But if you have gone through your fieldwork to that point in which some crazy thing happens, or you have a day where you show up and you have personal stuff that is bleeding through into how you're able to show up as a clinician, if up until that point you have shown really professional behaviors, that is going to help you. That is going to serve you well. You know, you're like laying that foundation, that assuming best intent. Your educator will assume best intent if you have shown up, if you have followed the, you know, what they expect, if you're adhering to the dress code. These little things really matter, you guys, and it is going to help me be your advocate too. So really, really, it's so important. So I just wanted to say that. So really important. It will help you. It's kind of back to that feedback thing too, where it's actually stuff where it will help you have a better experience in your fieldwork. Okay. References, yay. We made it. We have 3 minutes left, and I think this was good. So a little bit of redundancy on some of these concepts, but hopefully this is helpful. It's churning around in your brain now, and you're going to go out and have really successful, wonderful fieldworks. But you get to see me for a few more sessions. We're going to have one more. So next seminar, we're going to be covering bias. I'm going to try to have that a little more engaging, a little more discussion focused. And then we'll have spring break. Woo. And then after spring break are in-person sessions. So I've posted the room number on Moodle. I think it's 156. So we're going to be on the bottom floor of this building, 156. So we'll meet there for April 1st and April 8th sessions. And those will be nice. 165. 165. Thank you. So we will meet there in person. So one more Zoom session, and then after spring break, we'll have a couple in-person sessions, and then you start fieldwork. Continue to watch your email, guys. This is going to start to be kind of onboarding go time, but I think we're all in good hands. I've been telling folks in the meantime, if you're kind of like, what could I be doing to make onboarding go smoothly? Go to your My Record Tracker and make sure all of your stuff is updated and in there, and that will make onboarding go very smooth. So, yay. Okay, have a great afternoon and see you next week.